We looked at 1.3 million births in England between 2010 and 2012 and looked at a number of outcomes for both the mother and the baby by day of the week. And what we found was that mothers were more likely to develop an infection if they were admitted at the weekend. So this is an infection related to the delivery. And for the babies, we found a higher perinatal death rate. So that's death within 7 days of the birth, including stillbirths. A slightly higher death rate in babies born at the weekend. We also found that babies were more likely to have a birth injury if they were born at the weekend, and they were more likely to be readmitted following discharge after their birth. We've carried out a lot of work looking at weekend versus weekday differences, looking at emergency admissions where we found a higher risk of death in patients admitted at the weekend. We've looked at planned surgery. We've looked at specific conditions like stroke and found differences in not only outcomes but in the way that care is delivered at the weekend compared to weekdays. And this study is really an extension of that work, looking at a very key area of healthcare, maternity and obstetric care. We looked at administrative data, hospital administrative data, which is routinely collected by NHS hospitals on all patients admitted to hospitals in England. And we use this data to look not only at the outcomes, but to try and take into account any differences in the kinds of babies or the kinds of mothers that had been admitted by day of the week. So we were able to take into account things like birth weight and maternal age to make sure that this that we were able to explain any differences. In addition, we were able to look at consultant staffing levels and whether hospitals complied with guidelines on consultant presence in the maternity units. And we divided hospitals up into whether they complied with these guidelines or didn't comply with these guidelines. And in hospitals that didn't comply with the guidelines, we found a slightly raised rate of birth tears in the mother. This is part of a whole body of work that we've been carrying out, looking at differences in outcomes between weekends and weekdays. So this is really another piece in the jigsaw to suggest that performance in healthcare appears to be different at the weekends compared to weekdays. Now, this is just an observational study. It's based on routinely collected data. And we therefore can't for sure say that this is due to poorer quality of care at the weekend. But it does seem to fit in the jigsaw of research about this particular topic, and it certainly seems to be consistent with quality of care being different at the weekends. So I think what's needed now is more research on the underlying causes between these differences. We've started with looking at consultant cover, but there are all sorts of other aspects of care, for instance, quality of nursing care, availability of diagnostics, which we now need to focus on to try and explain these differences that we find.